You're listening to the Autism Weekly podcast. Each week, we share community voices and bring light to stories that increase awareness, acceptance, equity, access, and inclusion. If you haven't already, subscribe to join the Autism Weekly family. I'm your host, Jeff Skibitsky. This week, we're joined by Colleen Katzenmoyer, the newly appointed Vice President of Education Services at Devereux, one of the nation's largest nonprofit providers of behavioral health care. Dr. Katzenmoyer brings nearly 20 years of experience in education and behavioral health, and she's here to share how her new role will enhance services for families, schools, and communities nationwide. Welcome to the podcast, Colleen Katzenmoyer.
Thanks so much.
So, Colleen, one of the things I love to be able to do, just because we all have a unique story, and in our field, we wouldn't be here if we didn't have a passion, if we didn't have something driving us. And I'd love to hear your background, your story that brought you into education and behavioral health care.
Yeah. Well, thanks so much for having me on the podcast. Really, I'm just thrilled to be here. My background is that of a school psychologist. And it is a bit of a funny story. I was always, from day one of undergrad, I was a psychology major, loved it. It was a great fit. And I was in a 5-year master's program at the time. And springtime senior year, it started to not feel like a good fit. And I am, for those that know me, know that I'm a planner, I'm a type A person. So having this kind of, moment of what am I going to do was very uncharacteristic of me. And a professor at the time said, "Why don't you be a high school principal?" And I thought that she was loony. But that day I went back to my dorm and I actually Googled psychologists in school. And it was that day that I learned that there was such a thing called a school psychologist. And I made the change and went and got a master's degree in school psychology and became a school psychologist. And really, it was a perfect fit. And I've always been in special education and always will be. And that's kind of how it got started. It was just I found my passion and my career in a Google search.
So this is a slight tangent, but I didn't know your background was in school psychology. And one of the things that I think we'll probably talk quite a bit today is on access to care. Yeah. And there are many states out there that when you're looking at being able to get diagnoses, when you're looking at being able to get the appropriate cares, the recommendations or prescription for service for care, is that you almost have to go from a school psychologist to a clinical psychologist to an insurance provider it's this path of kind of lack of continuity. Are you in a state where school psychologists are able to be that frontline person from the beginning and are able to provide the diagnosis for care and be almost the shepherd for services?
Sure. So yes, the easy answer is yes. In Pennsylvania and really in education in the United States, school psychologists are able to make a diagnosis, but it is based on the special education eligibility criteria. So there are, 13 diagnoses available, and one of them being autism. So a school psychologist is able to make that diagnosis and provide a prescriptive care within the school system. Now, I think what you're also getting at, though, is that then, that gets you only so much, right? So that gets you a diagnosis to help you get the care that is required within a school. Often families need additional services, or children need extra services outside of school. And unfortunately, they are often, in a situation that you're talking about, where then they have to start over and start from the beginning and get another diagnosis and get another prescription on what supports need to be, what they need to in order to survive and thrive.
Yeah, no, and I only bring that up because it's almost like a pet peeve sort of concern of mine is the fact that like you have a child who's accessing 30 hours a week of schooling and are getting supports that are specifically tailored to them in that environment.
Correct.
Yet the same criterion to be able to access that for the other 10 hours of the week or whatever it may be that they need of service outside of the school environment requires a whole new path, a whole new justification, a whole new testing that maybe is even duplicative of what occurred. Um, and I think that what I've learned from you about Devereaux is that you're able to take a lot of those supports, a lot of that behavioral supports, a lot of what you're able to provide across a variety of environments and blend it into your care model. Can you give us a little bit of an example of, what it is that Deborah does within their education service model and maybe even the idea of what you do for continuity outside of the school?
Sure. I think that's one of the things that really drew me to Devereaux as well, is that in addition to schools and education, Devereaux has specialties and expertise in all these other service lines and all these other levels of care. And we are really doing a much better job as we go along to really coordinate those services for families so that they don't have teams that from all different places. Now, there are times, certainly, for example, when our students come to us, they often come with a large team of service providers. And it is just the expectation of our school teams to welcome all members of a child's team. So that includes the parents, but that would also include perhaps that they have therapeutic support staff or they have outside providers, and really including them as part of our day in order to make appropriate plans for the students, but then also really work with them so that there's a carryover on the care that we provide in the classroom carries over into the care that's provided elsewhere. And it has been, I think that there's a lot of barriers to accessing services, and it really is a focus of Devereaux to really make those barriers to overcome them as much as we can for our families.
So this collaboration, this coordination of care, I can sense that it's part of the excitement that drives your new role. But can you tell me, as far as stepping into this role of Vice President of Education Services, what are some of the initiatives that really are exciting you right now? I mean, obviously the coordination of care piece, but what other things are you looking at that are just, really driving you to kind of put in that extra time?
Sure. I think that the really wonderful fit that I've found here at Devereaux is that I've always had a passion for program development, program expansion, program improvement, and to be part of an organization that is also so enthusiastic and excited about expanding and doing new things and figuring out better ways of caring for individuals. And the fact that they've put their trust in me and their enthusiasm with me is a bit of it's a professional dream come true a bit. I think some of the exciting things that we have going on right now is that for a long time, our education services at Devereaux were a related service to and accessed by students who were in residential care. Those were what our schools were there those were the students that we were serving.
Mhm.
We've really been focused on expanding our day student population. So again, that goes to that, expanding access of these services for students who are not in residential care and for families who do not need that level of support. So in the past couple years, we have opened 3 schools in the past 2 years, and we are the paint is drying on a fourth school in New York.
Hmm.
And so that is very exciting. Some of the other initiatives that are exciting are really leveraging technologies that are available to expand diagnostic services. We've heard from our partners that, not only going to school is difficult, in certain parts of the state and certain parts of the country, but also just accessing a diagnosis that will then open doors for additional services. So we have partnered with our affiliates in a section of Pennsylvania that has not as many providers for diagnostic services. And we will be doing autism diagnostic services using telehealth technologies starting in October. So that's very exciting too. So again, kind of just in a perfect world, which one day hopefully will be, location and accessibility shouldn't be a barrier to families, and that's really where we're headed.
Yeah, the telehealth diagnostic piece, I think that it really started moving along during that time period of that's really when COVID was at its
Yeah,
height, where you had to be able to do that. But I think that it's gotten so much better over time with just what people have put into it to be able to observe and see and be able to kind of work through the system. Have you found that your psychologists are feeling like, hey, you know what? I feel pretty well equipped that, I'm getting 98, 99% of what I could do in person done via this telehealth system?
absolutely. And I think the other kind of silver lining of what eventually forced us into honing our skills in that way is that the process then of really getting a thorough evaluation has to include so much more than a protocol in front of a child. So you really need to be able to elicit input from multiple folks, including the parents, of course, get information from teachers, from caregivers. And I think that that has made us better diagnosticians in the long run, in
Hmm.
that we're not focusing only on standardized scores on a piece of paper anymore, but trying to think, you know, creatively and collaboratively on what information we need to get a better idea of the scope of what's going on with a child.
Hmm. And there aren't enough specialists out there right now
Right.
to be able to say, I got them all in this one location, in this one district. You really have to leverage the talent pool that's all around you, which I think the telehealth does as well.
It does. It does. And it services, so many services are delayed simply because there is not a provider that is within a certain geographical area. And really, that does not need to be a barrier anymore. We have ways of leveraging, to your point, the talent that we have out there, the expertise that we have out there, and then also being able to look at different ways of accessing technology in order to bring children to the folks that they need to be in front of.
And one of the other things that I think Devereaux is really focusing on is you have that school aged clientele. You have the student age, which oftentimes is not getting enough access to services just because there aren't a lot of providers out there. And everybody, not everybody, a lot of organizations have focused on the early intervention piece, but once somebody hits school age, they need programs similar to what you all are working on, and that you've built over time. I think that you had mentioned 12 states when we were chatting, and I mean
That's
that's
right.
wonderful. And I mean so many different school programs that are offered within those states. I do have a question on that, just because when you're talking school aged
Hmm.
and you're talking, and we'll talk autistic right now for those specific students.
Sure.
How have you seen the education curriculum evolve over time? And have you seen it change a little bit in the way that we're adapting to what we've learned through research, what we've learned through practice?
Yeah, I think that also that's so important. It's just even that question is so important because we really try not to be stale in how we approach our education, our schools. I think what we've noticed mostly in our schools is a couple things. One is that we see students come to us much younger than we did before. So some of our most successful programs, if you look at just the number of students served, are our primary grade classrooms, so kindergarten through third grade, which has been, I think that's definitely in response to what we all know that early and consistent intervention is so important. And in those early years, we're seeing so much growth as well. So getting students the more intensive supports early on has been very important. The other thing that we have been working really closely with our district partners is transitioning back to their homeschool programs. I think school districts in general, many, not all, but many school districts are doing a much better job of building in-district programs. So being able to transition students out of maybe our, standalone center-based programs, but back into their home schools with supports, that's something that Devereux really, we take as a big win. And so in addition to having those supports available at our center-based programs, we're doing a lot of work with school districts to help them set up programs within their schools and help with, single case consultation, classroom-wide consultation, and school-wide consultation to help provide as much of a traditional school experience for students with all different types of challenges. And then the other focus that we have with particularly with our autistic student population, are really working on transition services as they get older. And what does life look like after school? And what does life look like after Devereux? And that's really an area that, again, those systems have not traditionally worked well together. And we're really working on being far more collaborative with those services that provide supports to students once they age out of school age programming, so that that transition is more seamless. And so we can help to focus on pre-vocational training, independent skill training, and all of kind of those skills that students need in order to be, contributing members of society. And we're partnering with those folks on the other side of that birthday to make sure that we're working on the same things that they're going to be working on, and so that we can just kind of do a nice soft handoff to them.
Those are such wonderful priorities when you think about really empowering anybody. It's the idea
Correct.
is that I'm giving them the opportunity to be able to contribute in whatever way they want, in
Absolutely.
whatever environment they want. So how you're looking at those transitions, I think, is the way that everybody should be trying to figure out, how can I open up more doors? One of the things that you mentioned with transitions, and whether it's the transition back into public schools or the transition into the job world or into independent living, is that the role of the family, the role of that direct care provider becomes so important. And oftentimes with the autistic care models right now is that there are a lot more centers, there are a lot more schools, which create different barriers for being able to empower families to carry on those skills. How do you all tackle that challenge of making sure the family is constantly involved with understanding how to carry over all the work you're doing?
Yeah, Well, one of the main guiding principles at Devereaux is something called the Devereaux Family Standard. And that is kind of our litmus test to say that the programs that we have, the care that we provide, is at a level that we would expect, that we would want for our own loved ones to have access to. And that is part of the Devereaux vernacular. It's woven into the fabric of Devereaux. And so with that comes a constant, thought and inclusion of families. And it's not lost on us that we have, for the 6 hours of the school day, a family's most prized possession with us, and so I think that keeping that as a priority and keeping that on the forefront is really something that it helps us, it makes, including families and parents as part of our daily decision making, just something that we do because it's so much part of our programs and so much part of the heart of our organization.
And one thing that I've learned over time is that it's also really understanding the family's priorities. If you're not putting into context what's important for the child, what's important for the family, is that getting the buy-in, getting that ability to be able to transition skills across numerous environments starts to wither. And
Right.
When you're working with families, I would imagine the IEP process plays a big role in this, but
Sure.
how else do you bring out the voice of the recipients of care
Yeah.
throughout the process?
Well, I think one of the skills that is so important for the students that we serve is that they understand their IEP, they understand their learning profile, and they have an opportunity in whatever way that they can um, to have some decision making in that. So, including them early and often in IEP meetings, treatment planning meetings, is really important for us and important for our students. That's part of those life skills, being able to advocate for yourself as to what is easy for you and what is hard for you is part of, it's an important part of independent living. I also think that, the one of the things that we kind of keep in mind is that discharge planning starts on day one. And what that means is that right from the beginning, on the first day, we need to hear from the families and from our students as to what do you need from us and what are the goals for you and
Mhm.
how will we know when you don't need us anymore. So that planning is it brings in that goal of the family and of the students that we serve right from the beginning. And that's important. It often alleviates a lot of the anxiety, particularly with our students who, want to be able to say, I'm going to go back to, my middle school or something. So from the beginning that they get a voice to say, this is what I really need to work on. And this is what I want to be able to do, whatever that may be. It helps them to know that, they are just as much in the driver's seat as we are.
I think it reality checks everybody in the process as well to make
It sure
sure
does.
everything that's being done treatment planning wise or decision making is aligned with a goal. And I think
Correct.
that always helps. It keeps us grounded in understanding what we're doing and that we're not unilateral as teachers, as clinicians, or whatever it may be.
And it helps us remember that these are individual students
Hmm.
too,
Yeah.
and that's it's so important and it's a part of what we're expected to do and it's what we're committed to do is to provide individualized supports that meet the needs of each individual student that we have the privilege of serving.
Yeah, and so with that individuality in mind, one of if you go back 10, 15 years, is that one of the common complaints of the transition post-secondary or whatever it may be, when somebody is starting their independent living and their own
Mhm.
job skills, is that it was almost factory like. I'm only going to do this
Yeah,
job. I'm going to go in here. I'm going to sit in the same building every day, and this is all I'm going to do because that's all I'm capable of. That, of course, is not something that is seen in the same way nowadays, where it's kind of like, no, we should be trying to figure out what's important to this individual, helping to find the community partners and everything to be able to make their life enriched and live to the fullest. How do you all look at transition planning, and how do you find community partners to make sure that you have that way to be able to continue somebody's work development?
sure. So there's certainly, that we like to focus on not only interests, but we want to know what the interests of the student and the families are. So making something engaging and interesting is important, but then also looking at the skill development. So typically, how we approach transition services are taking a measure of what the child's interests are, but then also looking at their skills. And we have different programs that we utilize with that. One of which is we have PAYS labs in some of our schools, almost all of our schools at this point. And there's an evaluation process with that takes a look at their skills in all different types of domains. And we see, okay, what do you need support on doing and what are you able to do independently? And then through that process, we can help to support those skills and develop those skills that you need to have more independence in, but also get to know better what they're good at and what they
Mm-hmm.
enjoy doing. We try to include community-based instruction as much as possible. So taking those skills and generalizing outside of, a simulated work environment, but rather in kind of a real life environment. And just like with other types of instruction, scaffolding those supports to provide a lot of support in the beginning, and then working towards independence out in the community is really our approach. We have been fortunate to have really wonderful folks that are very passionate about job coaching and transition services that work for our organization. They do a wonderful job at making partnerships with local communities, local businesses, and just to have really open those doors. And then, once those communities have a chance to meet our wonderful students, it becomes pretty easy from that point on to keep that relationship going.
And these are the parallels that I love to explore between kind of the neurotypical and the atypical learning profiles, is that they oftentimes rely on the same things. If I were to sit down with
For sure.
my kids right now, I'm going to say, hey, let's look at where our strengths are. Let's look at where our strengths match our passions. Let's try and figure out where this goes and kind of figure out the next steps. How do we continue to pursue these things? It's no different.
No,
It's just a
correct.
little bit more focused, I'd imagine. Is that how you would look at that?
I do, yeah. And I think that there's also learning new skills comes easily for some children and becomes more difficult for other children. And what's hard for one is easy for another.
Hmm.
So I have a 16-year-old son, and we are absolutely having those conversations as to, at school, what is easy for you, what is hard for you, what do you want to spend more time studying as you go along. And the same goes with students that are in Devereux schools. What do you like to do, and what comes easy to you, and what is difficult, and what do you want to spend your time really working hard on? I think that where we go wrong in special education is if we take a running record of all the things that students are behind on, delayed on, have difficulty with, and make a plan for them to just keep doing it more and more and more.
Yeah.
I don't think anyone really wants to be a student that, it's highlighted what you can't do, and then every day you're just asked to do it over and over again. So as much as we can, it's taking a look at not only what is hard, but also what is easy and how can we make those hard things easier.
Yeah, I mean, you wouldn't ask that out of anybody in the workforce. You wouldn't ask that
Correct.
about anybody in any walk of life. It's like,
Right.
if that's not the right seat on the bus, let's find the right seat of the bus sort of
You got it.
idea and figure
You
out
got
where
it.
your strengths are going to be looked at as contributing and being something that's impacting everybody around you. So one of the things that I've seen, and I live in a state right now that is horribly under-resourced for special education and for education in general. So I mean, my perception of what's occurring is heavily grounded on understanding what happens when programs like yours are not given the resources that they need. So when you're talking about what Deborah is adding to the learning profile or the opportunity
Mhm.
for somebody to develop some of those emotional and behavioral skills, what happens if there isn't a program like Deborah that's able to focus on these particular skill sets or empower children? What are the ramifications of that?
Well, I think that you don't have to look far to see kind of the bad news on what happens when students are not supported. We know that students with disabilities, they are either underemployed or unemployed. The rates of underemployment and unemployment are much higher for individuals with disabilities than those without disabilities. And, that comes at a cost, and it comes at a cost in various ways, in financial ways and emotional ways. And it has a ripple effect, well past the individual. And so I think that that's part of the frustration, I think, that I kind of hear from you actually too, is that, if we're not investing in supports and in education, why not? Like what else could be more important than this? And I can't agree with you more. It really, because it's right there in front of us. What happens when you don't invest early in children.
And I mean, just talking with you thus far, as that innovation seems like a main driver, being able to make sure that you're moving with current research and making sure that you're totally invested in finding out what's best to be able to empower individuals. What other things are keeping you motivated to make a difference for children and families? Because there are times where we all, as clinicians, as educators, as administrators, run into these blocks, which can just be demoralizing at times. But what keeps your motivation
Sure.
going forward?
Yeah, I think that I often talk to school teams around the time of, like March. It's like the slog, like it's just the drudgery of the year kind of comes in that early spring. So we all experience that for sure. I think that the what's exciting and what's really a blessing about schools and education is that you don't have to look far for little wins and big wins, and that keeps me going. And being able to celebrate these small successes and knowing that small successes add up to huge ones is really exciting. And it really does. It is a very motivating to keep coming back to work when you get to see, these amazing people that we get to serve. And it could be as simple as, a child being able to go up to another one and say, "Hey, would you like to play?" That's an enormous win for some
Mhm.
folks. It could be opening a new school, which was a really exciting win. I tend to be a numbers person, so when I'm feeling a bit kind of in that drudgery, taking a look at just the numbers of individuals that we've been able to serve and how we've been able to provide more services, that helps me go along as well. Devereaux just released, we have an annual outcomes report, and so it's all in one place, of all the glitzy accomplishments that we've had in the past year. But it is very much focused on just look how many folks we've been able to meet, to serve, and how many partners we've made in the process. So that really has been, I think that's really what gets me going.
Yeah, I talk to parents, I talk to clinicians all the time about just that need to take a step back and reflect. Everybody gets caught in the moment. It's hard
Hmm.
to recognize and really celebrate successes of individuals, of
Absolutely.
your child, of anybody. And we
Yeah,
all need to do that and make that part of a regular plan to say, hey, take a step back, see all that you've done and be proud of yourself, be proud of
that's
your
right.
child. So where can people go to learn about Deborah's programs, their resources? Where can clinicians go to learn about, if this doesn't exist in their community, what could be an option for them to develop?
Yeah.
Where are these resources that Deborah offers?
So an easy place to start is our website, which is www.devereaux.org. And on the website, it provides the locations that we currently are in, but then also provides links to our services that are not based in one particular geographical area. I am proud to say that, if you were to reach out to anyone at Devereaux, I'm very confident that that person would get you to the right person, if it's not them. Although it's a very large organization, it does feel very small as well. We all work together really well, and if you're in Florida and you are looking at a school in Connecticut, we'll be sure to get you to the right place.
Well, I appreciate you coming on and educating me today, Colleen, and I hope that folks do look for those resources and reach out, just because the more that we can share, the better we become as a community on being able to take care of one another. So thank you
Agreed.
for coming on today.
Yeah, thank you so much.
Thank you for listening to Autism Weekly. We hope you tune back in next week to learn more about autism in the real world. Autism Weekly is now found on all the major listening apps, including Apple Podcasts, Stitcher, Spotify, Amazon Music, and more. Subscribe to be notified when we post a new podcast. Autism Weekly is produced by ABS Kids. ABS Kids is proud to provide diagnostic assessments and ABA therapy to children with developmental delays like autism spectrum disorder. You can learn more about ABS Kids and the Autism Weekly podcast by visiting abskids.com. Thanks for tuning in. See you again next week.